There is your question. Right, so if you have read and understood considering the history taking station, kindly begin.
Okay. Hello. Hello. Yes,
Hello.
I'm Dr. Anyola. I'm one of the exam candidates today. Can I know your name, please?
My name is Lorna.
Lorna. Okay. Nice to meet you, Lorna. I'm just going to ask you some questions about why you've come to the A&E today. Understand that you have some abdominal pain. Can you tell me where this pain is located?
It is just all over my
All
tummy.
over your tummy. Oh, sorry. Are you comfortable enough to continue this conversation? Okay. If
Yes.
at any point you feel uncomfortable, please let me know so we can get you some right pain medications. That's okay.
Okay.
Did this pain start suddenly or did it just build up gradually?
Just start suddenly.
Oh, sorry to hear that. So if you were to qualify this pain, how would you say it feels? Does it feel like a sharp pain or does it feel like a dull pain? Or how does the pain?
It's like colicky.
It's colicky. So does it wax and wane?
No, it's just all here all the time.
Yes,
Oh.
but it comes and goes. That's what
Does
quality
it
is.
come and go? Yeah.
Okay.
Yes.
Okay. And what time did this pain start? About how long ago did it start?
Just started about 2 days ago.
About 2 days ago. Oh, that's been a
Yes.
long time to bear such pain. I'm sorry to hear that. Do you feel this pain in any other part of your body? Does it radiate to any other part of your body?
No.
Okay. Has there been anything that has made this pain better?
No, just sometimes I take some painkillers.
Okay, and that helps with the pain, does it? Okay.
Yes.
Has there been anything that makes this pain worse?
No.
Okay. If you were to score this pain over 10, 10 being the worst pain you've ever felt and 0 being no pain, what would you score the pain?
It is about 9.
Oh, 9. That's very severe. I'm sorry you've had to bear that much pain. We'll try to get to the bottom of this as soon as we can. So do you have any other symptoms apart from the pain? Have you felt sick?
No.
Have you had any vomits?
Just have once.
You've vomited?
Time.
Okay. And what was the color of the vomit?
It is about it is the things that I have eaten.
Okay. I understand that you've also had some episodes of diarrhea. Is that correct?
Yes, I have some about 2 to 3 times per day.
Oh, okay. And that's unusual for you.
Yes.
Okay. Was there blood in the stool?
No.
Was there mucus in it?
No mucus.
Okay. Have you had this kind of pain before in the past?
No, this is my first time.
Okay. Has this pain affected your appetite? Have you been off your food?
Just sometimes that I don't have the appetite to just eat normally.
Okay. So have you noticed any weight loss of recent?
No, I have no weight loss.
Okay. Did you have any fever?
No, I have no fever.
Okay. So I would also just ask some questions about your general health aside from this active pain that's going on. Do you smoke cigarettes?
Yes, I smoke.
Okay, how much do you smoke?
It's about 2 to 3 packs per day.
Okay, and you smoked for how long?
It has been about 10 years.
Okay. Do you consume alcoholic beverages?
No, don't drink.
Okay. Okay. Are you being managed for any medical conditions? Like, do you see your GP regularly for any medical illnesses?
No,
No. Okay. Are you on any medications?
I just take some few painkillers for the pain.
Okay. Okay. Do you take any recreative substances, recreational substances?
No,
Okay. I would also like to know who is at home, who's been taking care of you for the past couple of days that you've been ill.
I'm with my family.
Okay, and hope this illness has not really affected them as well in any way.
No, there's no history in the family member.
No. Okay. Do you have any particular concerns at this moment?
I'm just concerned that has maybe something bad. I don't know.
Oh, I understand. That's a very, very legitimate worry and concern. Hopefully it isn't, and hopefully we're able to get to the bottom of this as soon as possible. So do you have any ideas what could have brought this on?
No,
No. Okay. What do you do for a living, Lorna?
I'm student.
Okay.
Okay, can you present your history now, please?
I've just spoken with Lorna, a 19-year-old student who presented to the emergency department with 2-day history of sudden onset abdominal pain, which has been generalized since onset. The pain is severe. She has scored it as 9 on a scale of 0 to 10. And it's colicky, and she said it's present throughout since the onset. It doesn't radiate to any other part of the body. Associated symptoms are nausea, and she's had 2 episodes of diarrhea, which are not bloody, and she's also had 1 episode of vomiting, which contained recently ingested meal. There has been no weight loss. There seemed to be no I did not ask symptoms.
Okay.
Yes. She's currently not sexually active. There is no fever.
So what are your differential diagnoses for this patient?
My differential diagnosis, I was thinking of an inflammatory bowel disease because of the what?
And
Okay, inflammatory bowel disease, irritable bowel syndrome. I would also want to consider the possibility of appendicitis or potentially perforated appendix, but because she said she's not had a fever.
Confirm your diagnosis?
I would like to do some investigations, including an abdominal ultrasound scan. I'll do I could also do an abdominal x-ray based on what I find, and potentially an abdominal CT scan to investigate further what I've found. If those are normal, like she might need a lower GI endoscopy, just to find out if there are any local lesions that could explain our symptoms. I would also like to do
what treatment
I'll also like to take a sample.
Can you offer her?
At this point, I'll try to keep her pain under control, because that seems to be the most pressing need at the moment. I'll try to keep her pain under control because she's had loose stool and she's had vomit. So I'd like to rehydrate her. I would also based on whether there's an indication. At this point, there really isn't an indicator for an infection, but if there is an indicator for an infection, I'd like to start on antibiotics based on the local trust guidelines. And then I would treat whatever we find to be the primary cause, and she might need a referral to gastroenterologist based on what we find or not.
Okay, good. Thank you. That was your first time, I suppose, with us.
Yeah.
So Dr. Mohammed, would you like to give feedback first?
Okay. Firstly,
has-
she was quite confident and has clear voice.
Yes.
When she started, she didn't ask about the age. I think you should say, may I confirm your name and age?
Yes.
At the same time,
Yes.
allow you to just
Saves your time.
sometimes,
Yes.
yes. And then about history of presenting illness, she forgot to tell about many things like uh, the radiations, the severity affecting my life, and also I think she didn't ask about the symptom of inflammatory bowel disease
Yes.
and IPS, like
Yes.
it is the pain relief by bowel opening or it is increased by bowel opening, and also symptom of constipations.
Yes.
Yes, in case of diverticulitis,
And
also idea, concern, and expectations.
idea concern, she asked. Expectation, she couldn't. But then she didn't even ask the family history. But then that comes later. She was asking about the presenting complaint, she forgot to ask about the menstrual history because it was a female patient. Menstrual history is very important.
Yes,
Young student, any history of stress, current stress, if she wants to do
social
a
stress.
activity, yes, social history. So, and then also travel history, travel abroad.
Yes.
These 2, 3, and then family history. And what was that, Dr. Inola, that you remembered yourself that you didn't ask?
I didn't ask for urinary symptoms.
Yeah.
Systemic
Yeah.
review.
And I didn't really
Yeah,
ask for
systemic review as
gynecological
well.
history as well.
So my little request is, because you're going to appear in the exam, once exam bell goes and you have to present your history, then if time has gone and you couldn't complete it, always keep in your mind the topics or the things that you have missed. You couldn't ask because the bell went. So begin with, if time would have allowed me, I would have asked this, and then present your quickly, just in one breath, right? And then present your history that I took the history from 19 years old,
Okay.
blah, blah, blah. So this will give a good impression and you'll score your lost marks as well, because everything costs, every question or every history has marks. So out of 20, you'll be able to get quite a lot.
Okay. Thank you. Thank you.
Yes, most welcome. Started your timer and here is your question.